Hang on.
Hello, my name is Breanna Chandler, and I had actually been following regenerative health for, I'd say maybe a year and a half before I came on board. I had quite a few friends who were using regenerative, and it just so happened that I hurt myself in a really bad snowmobile accident in Colorado, and I broke my femur, shattered my kneecap, multiple surgeries, tons of anesthesia on painkillers, crazy antibiotics for months, like months and months and months. And then I had to have a second surgery about 8 months later, so it was about a year of healing, awful drugs going into my system, completely throwing me off, and I knew I needed some help. When I first came to Dr. Ace, I even said, I felt like my blood was dirty. Everything was just so off. And she got me on an incredible program, cleaned up my diet, checked out all my hormone levels, and we figured out that there was lots of issues there, all relating from my surgery and the mass amount of trauma and inflammation in my body. And we're now working on healing my leg. So we've really been working on healing the body, and now we're focusing in on the leg and doing PEMF, electropulse magnetic therapy. I got it. And when we first started, I was really new to it. I've never really seen it done before. It was insane. My leg that I hurt wasn't responding, and she'd show me what normal responses would be on my other leg, and it would be jerking and moving and firing. And we're probably on session number 8 or 10 now. We've been doing it for many months, and I'm feeling my leg getting stronger, more muscle developing, the scar tissues breaking up, and the actual texture and fibers of the tissue and muscle are starting to finally feel like what they used to be. And I'm a dancer, yoga, very active person, and I just knew I didn't want this injury to be something that held me back for the rest of my life. So we're diving in deep right now and doing a ton of healing, and I'm so thankful for Dr. Ace and Regenerative Health for being part of that process.
So down here we can see we can activate her quads are finally actually starting to fire. So we got a lot of work to do on this atrophied area, but now they're firing, so we can do great work getting all the muscle fibers to come back to life, and we can assess the different areas that need to be worked on and find exactly where they're not activating. So here we really get nothing. Finally here we're getting something, so it means in here we're going to keep waking the fibers up.